follow-up conversation from October, where we started to have a discussion around vaccine distribution. So for those of you who don't know me, my name is Tracy Battaglia, and I'm honored to facilitate this evening's session. I'm a primary care physician researcher at Boston Medical Center, where I direct the Women's Health Unit and co-lead the community engagement program for our Clinical Translational Science Award. And so in both of those roles, or all of those roles, I am extremely passionate about the health of our communities that we serve. And so I want to start by thanking each and every one of you for joining this evening. I know how busy everyone is in their regular lives, but in the pandemic world, I know even how stretched we are beyond that. So being here is really important because this is a really critical topic for our community's health. Before I get started and launch into our dialogue this evening of some housekeeping items, I have Nick and Rebecca who are helping me with putting the logistics together. The Zoom format, just so that you know, we are recording this session in hopes that others will be able to participate and hear the conversation. Nick has muted everyone upon coming in. If you don't seem to be muted, we're going to ask for you to mute yourselves. We'll have just our speakers and panelists unmute. If you're having any connection problems, try turning off your video. And the way that we're going to structure the conversation is that I'm going to facilitate the conversation and ask that you add any questions, comments, or remarks in the chat box. And Rebecca's going to help make sure that I pay attention to all of the comments and don't miss anything critical. Our hope is that we're going to spend about a half an hour with some opening remarks from each of our panelists and have a good 30 minutes for open dialogue to answer questions that you pose in the chat. So I want to acknowledge that, welcome back all of you who joined us last month in the first part of this community conversation. On October 28th, our colleagues at the Harvard Clinical Translational Science Award hosted part one of this community conversation. You could see the esteemed list of trusted community leaders in Massachusetts who engaged in a dialogue talking about the National Academy of Medicine's guidelines for equitable distribution of the vaccine and their perspectives on that, those recommendations. This panel had a really lively discussion that talked a lot about how the pandemic has exposed our nation's systemic inequities and talked about the worrisome signs of low intentions to complete vaccinations, which several surveys have demonstrated that only half of the population would be willing to take up the vaccine, and with the lowest rates coming from communities of color who are most at risk. They discussed how the government's use of Operation Warp Speed to decrease vaccine development process did not foster public confidence or build trust. And in this next slide, we summarize some of the recommendations that were discussed from these leaders, because I think they're a great jumping off point for us to continue the conversation this evening. They talked about using existing distribution systems and trusted sources of health information. They talked about developing outreach strategies for specific populations. They talked about using conversations with the community, conversations like we're intending to have this evening, to complement survey data, to really understand other structured data and really understand our community's perspectives. They recognize that public health systems have been chronically underfunded, and support planning requires collaboration among agencies and organizations across the distribution process. There was discussion about establishing grassroots partnerships to inform communication strategies and acknowledging throughout this process that historical and present day injustice and discrimination is contributing to mistrust. So I ask you to keep those recommendations in mind as we go through this evening's conversation. In the few short weeks since we had our first conversation, a lot has happened across the country. In addition to a new president-elect, our country has witnessed the resurgence of coronavirus cases across the country, and we're bracing for the release of the first vaccines in an unprecedented timeline. With the combination of lifting restrictions on social distancing and social distancing fatigue, the start of the school year, and colder weather, we have seen an exponential increase in the daily count of positive COVID-19 cases in Massachusetts since October, as demonstrated in this slide, with the case counts being as high as they were when the pandemic first started. Just this week, preliminary results of 2 of the large-scale vaccine trials were released, suggesting that vaccination is indeed a promising path forward toward ending the epidemic. Tens of thousands of participants from across the country participated in these trials, demonstrating high effectiveness of the vaccine and no serious safety concerns. So I suspect, like me, you are overwhelmed by the known challenges to equitably distributing vaccines to our community. And as we all well know, vaccines alone don't save lives, vaccinations do. So our conversation this evening is really sort of focused on using our collective wisdom to talk about how we can do this equitably and successfully in Massachusetts. In October 2020, the Massachusetts Department of Public Health released an interim draft of their COVID-19 vaccination plan for the state. It's a very comprehensive document that I highlight at very high level on this slide, but it talks about partnering and collaborating with local communities to identify obstacles and resources and facilitators to vaccine distribution and readiness, with the recognition that vaccinations really lie within sort of the local public health environment. They created a COVID-19 vaccine advisory group. One of our panelists this evening, John Rocchio, is a member of that advisory group, so we're going to hear a little bit about his experiences in that group. There's been a focus on health equity within the sort of COVID-19 statewide groups. There's been investments in community grants and a community impact survey to understand the needs of our community. And there's been widespread recognition that communications plans need to tailor messages for critical audiences, utilize media for outreach, and utilize community engagement methods to make sure that we're successful. And that is the spirit at which we approach tonight's community forum. Before I open it up for discussion from our panelists, let me introduce you to them. I'm really excited about the expertise that we have to join us this evening. So you can see on your screen, we're going to be having conversations with our community leaders. They represent 4 very different and unique institutions and agencies, and collectively they have a wealth of knowledge and interest in helping us successfully distribute the vaccine across the state. So Jackie Fontes is the Chief Medical Officer at East Boston Neighborhood Health Center. She's a family medicine physician who has been leading East Boston in their vaccine distribution around not only COVID-19 testing, but also around influenza vaccination. So their lessons learned there are informing their plans for COVID-19 vaccination. So we're excited to hear from her. We have Jennifer Lowe, also a family medicine physician and medical director at Boston Public Health Commission. She's in charge of their emergency preparedness department and will be helping the city think about how to distribute the vaccine. We have John Rocchio, who's the Senior Director of Pharmacy at CVS Health, and also a member of the Massachusetts Department of Public Health Advisory Committee. And then we have Cassandra Pierre from my own institution here at Boston Medical Center. She's an infectious diseases doctor and is our hospital epidemiologist here at the medical center. So I'm thrilled to introduce you to all of them. I'm going to stop sharing my screen so that we can see one another. And I'm going to now open it up for our panelists to provide some remarks. So the way that we will structure this evening's conversation is that I'm going to ask each of our panelists to provide about a 5-minute summary of the work that their agency is doing around vaccine preparedness. And after each of our panelists have had an opportunity to respond, we will open it up for questions. So don't hesitate to put questions in the chat as we get started. I'll do my best to facilitate all the questions in the chat. Rebecca's going to help me to make sure I don't miss anything major. We're really excited for this dialogue. So with that, I'm going to ask that we start with John. We're going to ask each of the panelists to briefly share what their agencies, organizations are in plans to support vaccine readiness in Massachusetts. And so John, with that, I'm going to open it up for you.
Thank you, Tracy, and thank you everyone for joining and taking some time out of your evening to talk about something that is critical and something that we will all be working very hard with both our families and our colleagues to ensure that we're educating those in the public around the importance of vaccination against the COVID-19 virus and all of the hardships that we've endured over the past 9 months. So thank you all for being here. So getting into the material a little bit, I just want to speak from first and foremost as a pharmacist and also as part of CVS Health. We are leading advocates in vaccinations, and this isn't limited to the current pandemic. We know that pharmacist-based vaccination has grown incrementally over the last 20 years or so. And we've also seen that the advocacy put forth by your cornerstone pharmacist providing immunizations has gone a really long way in educating the public. And it even brings me back to when I did my immunization training back when I was on the bench working as a retail pharmacist. And within that training, we discussed the pathway of how vaccination had come about and expanded into my profession when it was previously leveraged by physicians and nurses alike. But seeing that there was a lot of questions around pharmacist-based immunizations and a lot of the concerns with will the patients know to get their vaccination? Will they be checking with the prescriber? And when you looked at the data that came out of California being the first state that put that forward, it was seen that the vaccinations at physicians' offices went up incrementally as well after pharmacist-based immunizations started to take place because of the advocacy for getting it. So with CVS Health and my organization, we know that we are a major player in that realm, and we understand the importance of educating our patients and making sure that they are aware of the importance of receiving vaccinations. So this season alone, it's something to really look at. We have doubled our influenza vaccinations at the same point last year. So good story there is that the public is certainly becoming aware of the importance, and we know that Governor Baker and others have been at the top of the line and advocating to go and receive your influenza vaccination, and we'll only see that increase as we move towards the COVID vaccine becoming available. The trust and reliability we see of our patients is exemplified with those numbers that I just mentioned. So we're pleased that folks are going out there and getting their vaccinations, and it's discussions like this and discussions on the ground that have really made that possible. For preparations around the COVID-19 vaccination, we know that education is key, and we're sending educational materials to all 414 of our retail locations in the state of Massachusetts, which will be delivered to patients by 13,000 pharmacists, 28,000 technicians, who we'll speak about a little bit more later, as well as our nurse practitioners and physician's assistants that work with us in our Minute Clinic branch. There will be comprehensive in-store communications drives, leveraging our circular, our prescription bags, our receipts, which may get a little bit longer, but the good news is that information will be around receiving your COVID vaccination and how to schedule your COVID vaccination when the vaccine becomes available. We're going forward with radio and phone drives to make sure that the message is getting out. I'll speak a little bit more about radio a little bit later as well. And also in our delivery prescriptions, there'll be inserts that detail how people can go on and sign up for their COVID vaccination, which would be a 2-vaccine schedule. So we can also leverage our digital platform, something that we've grown greatly with the times over the past 10 years. As you may know, if you're one of our frequent patients or a consumer at our CVS locations, we have text messaging capability. We can send reminders to folks who have enrolled around receiving their vaccinations, as well as those enrolled in our extra care program, getting emails that detail what you need to know about the COVID vaccine and the availability and how to find your local CVS to be able to get that vaccination. There will also be comprehensive information on our CVS.com platform that you could even go to today and see various information around receiving your vaccination. So I know that there'll be many folks out there interested around our plan and how we're going to be able to fulfill the plan, but I want everybody to understand that we've been working comprehensively with the Centers for Disease Control. They will be the ones that are facilitating the vaccine delivery to both the state, which will ultimately go down to all of our locations, as well as other pharmacies that are under contract with the CDC. We won't be sitting there making decisions based on which virus vaccine to be able to leverage. It'll be what is provided to us, and will help in the distribution and the vaccination of the public. So we're really looking forward to the next few months, and there's been plenty of focus on over 25 working groups in all different facets to be able to make sure that we hit the ground running and we're able to provide the vaccine. Bigger than anything else in all of this, and why we're here today, is to discuss the equitable distribution of the vaccine once it becomes available. Not only am I working on the vaccine advisory group, which that is the prime focus, I am also working within my organization and seeing the efforts that they're putting forth. And it's so clear that their focus is on getting to these difficult and challenging areas where vaccination confidence is low, and education and being able to speak and really engage with our patients in those locations are going to be key. So after we get through the phase that we're working with our long-term care practices, where the CDC is providing vaccines, we're getting to those most vulnerable patient populations, we will see that grow out further and further, where more vaccine becomes available, but we're still going to be following the government's lead on equitable distribution, which comes out of the state advisory that I'm working with, as well as the federal guidelines and what we need to do to make sure that the areas that are in the greatest need are receiving the vaccine in a timely manner. More on what I was saying before around vaccination hesitancy. We see the statistics, we see the challenges we see in certain areas where folks just aren't confident in getting the vaccination, and they want to wait until others get it. And what's more troubling about that is we see in the areas that are hardest hit, they seem to be exemplifying the highest rate of hesitancy. So getting out the message to those areas is key. And in looking through all of our documents and all of our research and what we're putting forward, we find that 20% of our retail locations are located in moderate to dominant Black and Hispanic communities. CVS Health has an extensive ongoing plan to increase awareness in these communities to make sure that we can impact those folks and be able to get them the vaccine and have their confidence level high so they know that they can come in, receive it, it'd be safe, effective, as cleared by the FDA on the emergency use authorization. So we're really looking forward to that, and really pressing hard and making sure that we're getting out there to those folks and making sure the equitable distribution of the vaccine through the government guidance is being maintained and executed with our resources that we're fortunate enough to have in the state and across the country. We're also a funding partner in iHeartRadio's Black Information Network. This is a 24-hour-a-day news network with Black voice and perspective distributed nationally through iHeartRadio's app, as well as on AM and FM broadcast, again, reaching out to those critical populations that we have to engage to get the confidence up in receiving the vaccination. And lastly, I just say, from my vaccination advisory group position, I've been honored to be a part of that panel. The community leaders that have been brought in, along with the physicians and the Department of Health experts in the subject matter, the group has been just an amazing group to work with. We meet every week for a couple of hours, and the discussion points are great and right along the lines of what I know that this group is looking for around vaccination hesitancy, the communication needs, and the integration of practical considerations of logistics along with the prioritization framework. So I'll pause there. Happy to hear and look forward to hear from the rest of the panel, and look forward to your questions when we're concluded.
Thanks, John. There's a number of really great questions in the chat. I am paying attention to them, and we will get back to them, but we're going to move along. I just want to acknowledge, John, the real focus that your organization is taking on communication and education in the multiple different venues in which you're doing that, and taking advantage of some of your partnerships to be able to do that. So we'll come back to that. So thank you. I'm going to turn the tables to Jennifer Lowe. Dr. Lowe is joining us on behalf of the Boston Public Health Commission, and she's going to be talking with us a little bit about her experience, the experiences of her agency in preparing for vaccine distribution. So Jennifer.
Hi, everyone. Thank you so much for joining me this meeting and joining the panel. I know that this is going to be a really exciting conversation, because I know this is very much in the forefront of everyone's mind as vaccines become available in the hopefully very near future. I am the medical director of the Boston Public Health Commission, so we are being very thoughtful about how equitable distribution of the COVID-19 vaccine will occur. I'm also as I mentioned, I'm a primary care physician, a family medicine physician at a community health center in Boston, Greater Rosendale Medical and Dental Center. So I see firsthand in patients around vaccine hesitancy and how that can impact their health. So this is something that's very concerning to me as we deal with this pandemic. So just a little bit about Boston Public Health Commission. It's the country's oldest public health department, and our mission is to protect, preserve, and promote the health and well-being of all Boston residents, particularly the most vulnerable. We achieve our mission by supporting accessible community-based health and social services, ensuring community engagement and community voice in our work, advocating and creating policies and regulations that support health and well-being, and providing education around health promotion as well as disease and injury prevention. Within Boston Public Health Commission, we house the Office of Public Health Preparedness. And through this office, we focus on preparedness, response, and recovery roles, dealing with the health and medical impacts of emergencies for the entire region. We work closely with partners within Boston and the Metro Boston area, as well as state and federal partners. So I bring up the Office of Public Health Preparedness because it's important to note that OPHP and the City of Boston have addressed vaccine preparedness since its inception. So every year we create a flu vaccination plan. In 2009, we served a critical role in coordinating and collaborating on mass distribution of the H1N1 vaccine. We also have been involved with vaccine distribution for various outbreaks, hepatitis A amongst homeless population, as well as meningococcal vaccination programs in the recent past. PPHC is also committed to applying racial justice principles as described in our Equitable Community Engagement Plan in order to engage residents and other stakeholders in planning and decision-making opportunities. This plan emphasizes BPHC's responsibility to engage those most impacted by or excluded from government decisions, historically excluded from government decisions, often based on race. With the principles of racial justice and community engagement, we can begin to understand vaccine hesitancy in our community and support community identified strategies to address concerns. So it is with these principles that we want to emphasize the importance of partnerships with community-based organizations in order to maximize Boston's ability and Massachusetts' ability to address vaccine hesitancy. And it's not just in partnering with these community-based organizations, but in supporting their efforts to engage the community. Many of these community-based organizations have suffered tremendously over the course of the pandemic, and we really have a responsibility to invest in these organizations because they are the lifelines, the connections to how we can interact with community members that do not trust government or healthcare agencies. So when I say support community-based organizations, I'm really talking about providing the resources and the space for them to identify the most effective strategies, facilitate implementation of these strategies, and understand what their perspective is and their ideas are and encourage the engagement and they lead the efforts that they have identified within the community to address vaccine hesitancy. That's it. I'm sure there are going to be plenty of questions that we can discuss in the panel. Thank you.
Thank you, Jennifer. I really appreciate the conversation, and I'm interested to hear more about how you're supporting your community-based organizations to be able to stand up, to be able to sort of help in this area. So thank you. I'm going to turn it now to Jackie Fantez, who is representing East Boston Neighborhood Health Center. So Jackie, thanks so much for being here. We'd love to hear from you how East Boston is really thinking about preparing for vaccine distribution.
Tracy, thank you so much for inviting me and being with these great panel members and hearing what CVS and Boston Public Health Commission, we really have teamed up with Boston Public Health Commission through this entire process, and it's and I am certain we will continue that partnership. You know, most importantly here in East Boston, you know, we have a very long history. We've been here for 50 years, providing healthcare, vaccines, and other services in East Boston. And we will capitalize on that, that long history of supporting our communities and partnering with our communities. The trust starts with the, you know, with this history, and that's the main reason why I think community health centers will be one of the best distribution sites, especially to get into the underserved areas. And those, you know, and those areas being the hardest hit by COVID. We have a lot of history with vaccine distribution, you know, whether it's the flu shot every year, H1N1, you know, what have you. We have great history in mass vaccination. We also have a very impressive immunization rates for both our children and our adults, and we're very proud of that, and we'll continue to partner with our communities to ensure that our vaccination rates, especially, you know, in the COVID vaccine, will be high. Since the beginning of the pandemic, we've had regular communication with our community and the residents about COVID-19. We will continue those communications. We've done that through text messages, social media, live Facebook sessions with local politicians. Lots of our providers have gone on TV, newspapers, what have you, to educate the community around being safe in COVID, and we'll continue that for the COVID vaccine. We'll utilize our website. We have a huge amount of testing going on. We're doing 2,000 to 3,000 tests a week for COVID, and so we have large sites around the city as well as locally here in East Boston. And that's where a lot of communication with our community will happen. We have contact tracers through the ambassadors program, and we'll utilize those ambassadors as a key role in helping to build trust in the vaccine. We have lots of community health workers and care navigators at our community resource center that is involved in our food distribution that has, you know, really ramped up in this COVID pandemic, and we'll utilize, they are very trusted members of the community, and we'll utilize them to help build the trust. Well, I saw, you know, one of the questions that had come up around multiple languages. We find that to be very important in all of our healthcare, and we'll ensure that all the education is culturally competent and linguistically appropriate for all of our community. Like I said, we'll be teaming up with the City of Boston, Boston Public Health Commission, local politicians, our local hospitals, the Mass League of Community Health Centers, local media, local businesses, just to get the word out and the trust in the vaccine. We need to identify the people that really, you know, I think one of the hardest things for this COVID vaccine process is going to be the rollout, and you have to triage and prioritize how we're going to get this out. And we have a long history of utilizing high-risk registries in our electronic medical record. We were early adopter of electronic medical records and have over a 20-year history with that. And so we have very highly developed high-risk registries. We have few geriatric programs, the program for the all-inclusive care of the elderly, our senior care options populations that need to be vaccinated as soon as possible. And I think one of the points in our community, being the very hard hit during this COVID pandemic, our community is filled with essential workers. and they've had to go to work through this whole pandemic. Getting them vaccinated is going to be very, very important, and educating and advertising to the entire community so that we can really mitigate the spread of COVID in our hard-hit community. And we'll be gathering data so that we can report for ourselves, to the city, to Boston Public Health Commission. We'll be gathering data around zip codes, age, gender, race, ethnicity, and make sure, utilize heat mapping to make sure that we're getting the vaccine to the right people. Here at East Boston, we know firsthand that racial, ethnic, and social disparities of COVID. We've been participating in citywide testing for COVID in order for our patients to have excellent access to testing, and as an effort to mitigate the spread of COVID in our community. This participation in mass testing has prepared us very, very well to plan for a mass vaccination campaign for our community. And once again, to maintain cultural competency and linguistic competency in our education and distribution. We'll do everything to keep our patients safe. We'll continue vigilance with the message of social distancing, masking, hand hygiene, and testing and flu shots while we wait for the vaccine and for enough vaccine. We'll keep following the research. We won't distribute an unsafe vaccine, and I don't think we'll be given an unsafe vaccine. And we have a team of very dedicated clinicians following all the literature, and so that we can really educate our community well. And I will stop there.
Thank you, Jackie. East Boston certainly has a legacy of serving the community, and that sort of trust in the community is critical. And so we have a lot to learn from you about your approaches. So I have tons of questions, but we're going to move on to our last but not least to hear from our last panelist before we open it up. And keep the questions coming. They're wonderful. There's some themes that are emerging. I'm going to do my best to get to them as quickly as possible, but we're going to let Cassandra Pierre, who's an infectious disease doctor at Boston Medical Center, tell us about the experiences at our medical center here and plans for equitable distribution of COVID-19 vaccination.
Absolutely. It's a pleasure to be here, and I apologize that my head is so large on this webcam, so please excuse that. Thank you. It's wonderful to be here tonight in good company talking about this. This is a topic that I've been consumed by. Here at Boston Medical Center, we also sit in an intersection of marginalization in our communities, many who have severe underlying comorbidities, many who have been suffering from various forms of oppression historically and currently. And I feel like at this time, our combined interests at Boston Medical Center have been in identifying opportunities for infection prevention among our patients and our healthcare workers alike. Many of our healthcare workers are of the community that we serve, and of course with the lens of equity as well. And it strikes me during this process that there really is no us and them as much as sometimes our subconscious wants it to be so. This virus renders healthcare workers and patients equally vulnerable. And as healthcare workers, we are both consumers and potentially advocates or ambassadors for a potential COVID-19 vaccine candidate. And so this is something that we know is going to be essential, not the end all be all, but essential in our arsenal, our library of infection prevention tools. And so it's really important that healthcare workers feel like they're engaged in the discussions around vaccine safety and efficacy, and that they are as knowledgeable as possible about its potential distribution. And in fact, one of the things that Boston Medical Center has begun doing to engender trust in the vaccines and the distribution process has been to be transparent to its healthcare workers about the importance of this vaccine, spotlighting it in weekly COVID-19 related bulletins. We talk about health, we talk about infection prevention, we talk about protecting health, we also talk about vaccines. And obviously that's critically important now with the growing news about vaccine efficacy that we can see in the media. But Boston Medical Center is also a trial site for the Pfizer vaccine, and I think that's really important. We talk all the time about representation in clinical trials of communities of color and other marginalized individuals. We talk about how it's necessary to improve those numbers. And there are people here, the PI of the study, site PI Elizabeth Barnett in pediatric ID, people in leadership, people in pharmacy, people in research, who have made it their mission to bring this study here and enroll as aggressively as possible to ensure that we could say not only are we participating in scientific dialogue and ensuring that we can improve equity and representation in this trial, but we also are offering this vaccine to our community, again, of marginalized people, including communities of color. And so our conversations and our communications about vaccines include information on this trial, which is open to not just members of the community and patients, but healthcare workers alike. So it's, again, very important that we be knowledgeable as healthcare workers, because we are, and in fact, potentially negative or positive ambassadors of this vaccine. And we also have an excellent playbook to operationalize the vaccine distribution based on our very long-standing comprehensive model with influenza vaccinations. So we've traditionally had very robust methods of vaccination in the inpatient and outpatient settings. And this year, in the setting of a pandemic and the concern for the twindemic, for a flu influenza pandemic, which, knock on wood, has yet to arrive. We have also retrofitted vans that go out to community and increase engagement, added a drive-through for vaccination. Even our ED has started to get in the game and looking towards flu vaccinations within the ED. And these are all models of what we plan to retrofit to allow for similar messaging, marketing, and the familiarity of an apparatus that will hopefully engender trust and allow our patients to come in and get tested through successive waves of prioritization. We've worked within BMC, within pharmacy and our therapeutics committee to ensure that our planning and infrastructure for vaccine storage and administration is solid. And we know that this is going to be a critical issue for the vaccine. We've heard so much about the cold chain and the importance of storage that's unique for these vaccines. And we have also, similar to Dr. Rocio, been involved in the state's task force. Our own chief pharmacy officer, Dave Twitchell, has also been on board. And part of those conversations, which really allow, I think, for a bi-directional flow of information, we're able to effectively advocate for a vulnerable population and discuss methods of allocation within the state that are fair, not just equal, but equitable based on the populations that we serve and who are at higher risk for severe complications of COVID-19, and able to also hear more about the prioritization, which allows us to have already taken a look at our healthcare workers who we know are going to be the first wave of vaccinations, and characterize those who we know are at higher risk for COVID-19 based on the location of work and their patient care. And I stress the location of work here in my conversations about how this has been working. We know that we don't want to create and perpetuate the bias that exists in our medical system by stating that certain roles are prioritized, for example, physicians and nurses over CNAs or environmental services. We know that there is a function of location being involved in that risk, and we want to stick with that and not, again, perpetuate those hierarchies of bias. We have also looked through and identified, looking at our patient histories, or the patients that we serve, who we are going to need to vaccinate based on the initial rounds of prioritization for underlying risk. So knowing how much vaccine is at play, how much we can allocate, we can more credibly and quickly and nimbly prepare for what our vaccine preparation and preparedness will be when we, probably sooner than we know it, get the vaccine delivered to our doors. So I think that's all I'll say now. I have plenty more to say, and I'm really excited to participate in this conversation.
Thank you, Cassandra. Appreciate it. I know I really appreciate the focus on the healthcare workers as sort of, educating them and really focusing on utilizing them as trusted members in the community. And so I know from the National Academies of Medicine recommendations and the Massachusetts recommendation, prioritizing vaccination of frontline workers is sort of the first phase. And so you've just outlined a couple of ways in which you're really focusing on that to ensure that happens, but also how those groups will also help us build confidence for vaccines, for other populations at risk. So appreciate that.
There's a lot more to say though, so about that.
There's a lot of questions in the chat. I'm going to do my best to come up with some themes. We're probably not going to get to everything, but there was several questions in the chat around educational materials and ensuring that they're culturally and linguistically appropriate. And several of you sort of touched on that. I wonder if folks could elaborate a little bit further, because I think there's interest in understanding how best to communicate to these populations. So any best practices, examples?
Tracy, I'll step in and say that's at the forefront of what we're doing in the research that I've looked at, seeing that we must increase the awareness and education, tailoring communications to address the unique concerns of each community. That's quite a challenge, but it's one that we understand that we have to undertake. So absolutely, materials will be in the language of the heart of the patients that visit those locations. And another thing that I said I would harp on later, and I'm glad we've come into it, is the folks that work in our pharmacies, especially our technicians, they're from the communities. They're now been empowered through the HHS guidance to be able to become vaccinators as well. And as with all of our vaccinators, they're going to be the ones that are receiving the vaccine they can advocate for it. And it's going to be a great thing to have those technicians taking part as well. We're really excited about that. And it empowers them to understand that their careers do matter. There are people in there that are on the front lines day in and day out, and they're part of the community. So I look forward to it. From a advisory group perspective, having those community leaders within that group has been crucial in understanding those needs and coming up with those ideas that in my life, I might not come up with those ideas. I need to have other folks bring those to me, and seeing that, it's been excellent. Outstanding. Reverend Liz Walker is a part of it as well. So we understand that the challenges that are faced as I look down the questions, but absolutely the languages and also the cultural appropriateness of it is key.
I'm just going to, sorry.
Go ahead.
Yeah, I'm just going to second the importance of that. I think we probably struggled a bit with our messaging for infection prevention and preparedness in communities throughout the state during our first surge. And that was a painful lesson. We didn't have enough information in sufficient languages. They weren't also culturally competent. And cultural competence is not just about the language, right? It's also about understanding that our patients live in multi-generational households. So when you talk about quarantining, how are you going to tell someone to commandeer a bathroom and a room to themselves? We have to be flexible, and we have to adapt our infection prevention and public health messaging to the circumstances in which people live. So I'm hoping that we've learned our lessons from those stumbles. Many people at Boston Medical Center may not be aware, but we do in our discharge summaries have information that have been tailored, including with graphics in different languages, to allow those who are being discharged to have sufficient information, whether they're COVID positive or not, to protect themselves when they leave the hospital. It is my hope and intention that we leverage those same resources to adapt them into linguistically and culturally competent recommendations for vaccination. That being said, I think there's the formal and informal communication. So I completely agree that in our formal messaging, we need to have a multiplicity of languages represented when we're tapping people, asking them to come in for their vaccinations, to their primary care locations, or to alternate locations that we recommend depending on their 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 lifestyle, what they want to do in terms of convenience. But I think the informal mechanisms are some really important. So I shouldn't say this is informal, but our social media campaigns will also carry this message. Our communication teams are on board and activated. But myself and a number of other physicians of color have been emboldened over the past few months to realize that negative social media messaging and misinformation has already had uninterrupted and a lack of competition when it comes to having messaging and targeting communities of color with vaccine misinformation. And so we started to work with the community organizations to talk about, okay, so what are we, with our lived experiences, people of color, what can we add to this conversation? So I've certainly started talking first about just bare minimum. Who do we trust? How can we get this information out? Why should you believe me as a physician, as part of the medical establishment, when I say you should be getting these vaccines? How do you know that I've actually looked through the literature to understand that it is safe and effective? And so I think making sure that we use our cultural capital to the best of our knowledge is also going to be important. That can be formal or informal. Sometimes informal may actually work best.
Thank you. Jennifer, do you have something to add?
Yeah, I just wanted to add that, just highlighting that the word of mouth is probably one of the most critical tools that we have. And so I noticed there was a lot of questions about how are faith leaders involved. I think utilizing faith-based leaders and community-based organizations are very much a part of that. Materials are obviously important. Social media is obviously important, but oftentimes just having direct communication with that trusted individual, the influencers, if they are on social media, is going to be key. So leveraging those relationships, that reference to the community-based organization relationships, leveraging those relationships with faith-based leaders and community-based organizations is going to be critical.
Thank you for
I
picking
think from the community health standpoint, I like the term that Cassandra just used about cultural capital. One of the things that we do quite well is hire from the community, and we really try to have our staff look like our patients, and so that we can really understand culturally, linguistically, socially, the things that they're going through, and we will leverage that in trying to educate around the vaccine and the importance of the vaccine. And that's why it's going to be the same thing also, around what Cassandra talked about of educating our healthcare workers and getting them immunized and feel safe getting immunized, and will be able to help us with it within the community. And then of course doing it very linguistically appropriate. We've done a really good job during our COVID testing of making sure that all the education and results, what have you, are linguistically appropriate, and we'll continue to do that.
Thank you. I appreciate that. I want to acknowledge in the chat that there's comments about languages other than Spanish and Asian languages. And I also want to acknowledge that there's discussion around the fast changing nature of the information that's coming out and ensuring that our communications are sort of keeping up with that. And so some of the venues that were discussed are amenable to that, right? Word of mouth, non-print kinds of sort of communications. And so I just want to acknowledge that. And then there was another comment around, positive messages versus negatives, and sort of communicating in a way that sort of builds off the strengths of our community as opposed to sort of identifies their gaps. So appreciate all of those recommendations in the chat. And there's also interest I see in getting materials that were mentioned by our panelists. So we'll make sure we get access to all of the great resources that we've been hearing about this evening. I'm going to go back to an earlier question in the chat around cost, right? And so I don't know if any of you want to comment on sort of the issue of cost. Who's paying for these vaccinations? There's not just one, but there's two. Who's paying for the first one? Who's paying for the second one? And what are we doing to ensure they come back for that second one?
Tracy, from a CVS Health standpoint, I can say that the federal government is providing the vaccine, so there will be no charge of the vaccine. And everything around administration would be billed through insurance. If a patient doesn't have insurance, there's avenues there that will be covering it. So there will be no cost out of pocket to any patients.
Thank you. There was also a number of questions around logistics. Logistics around, handling the vaccine and their storage, getting folks to come back for the second vaccine. How are folks sort of thinking about and preparing for those aspects?
So I'm happy to talk a little bit about the logistics, although I'm not intimately as involved with them. But I will say that clearly we know that there are a number of considerations for storage. The Pfizer vaccine needs to be stored, and Dr. Richard could speak more knowledgeably about that, between -70 and -80 degrees centigrade. And the Moderna vaccine needs to be stored at -20 centigrade, -4 Fahrenheit. We have the capacity here to store both of those vaccines. And so that's not an issue. There was actually some concerns that we had about the Pfizer and how that would work in terms of the shelf life and the ability to go to be used for some of our community engagement. If we were using the van or doing the drive-through, the shelf life would not be as long. And so that was a significant concern for us. And so it's nice potentially to be able to have options, but we'll see what the data shows. The second dose issue has certainly been a challenge because, there are many issues involved with the logistics, really. Even for the first dose, we can't necessarily rely on the fact that a patient has a visit and has already accepted verbally over the phone a vaccine as an indication that we need to thaw out the vaccine, bring it up to the floor. If the patient doesn't show, if they show late, if they change their minds, we understand that our patients have different priorities because of where we sit. Many people prioritize other things over their healthcare experiences, and that's understandable given the social and economic climate that they face. And so we have to figure out, we have been working on figuring out a strategy to allow for the fact that we cannot prepare the vaccine ahead of time and have it ready for the patient when they come into clinic, but develop some kind of efficiency to allow for that vaccine to come up as soon as possible when the patient does arrive. And the second vaccine, I think I'd be certainly interested I'm interested to hear other people's perceptions on this, but I think that might actually be, there are roles for multiple different models of administration, but thinking of where we sit, administering it through primary care may be helpful in that regard. You have a relationship with your primary care provider. You come in for the first dose, people can hound you for that second dose. You're more able to leverage the trust that's been built up in that relationship to help people to come back. There are probably many other methods, but that's certainly what we're hoping on leveraging.
I have to agree with that. Sorry. Go ahead, Jennifer.
I think you and I are going to say the same thing.
Yeah, probably. Yeah, the primary care is the place to do that. I second that, is that we have the trusted relationship as well, as well as all the registries of our patients. We can track them. We've been doing that for a long time. We have, multiple vaccines that require the second or third dose, and tracking folks and finding them and getting them back in.
I also just wanted to comment on, Jackie referred to our partnerships around the H1N1 vaccine. So I can speak specifically to Boston when during the H1 vaccine pandemic and distribution, Boston Public Health Commission worked very closely with our existing partners and community health centers to really push out the vaccine, facilitate materials to administer the vaccine, and really relied on them as a resource. I mean, we're very lucky in that they're across Boston, community health centers are almost in every neighborhood. And of course, there will always be pockets where community health centers will not exist, but that is a very valuable network. And again, we have this natural partnership that's already established between the hospitals, the health centers, and the Public Health Commission to make that extra step. I think someone mentioned, the distance or the gaps. I mean, I think that's really the value of this network and collaboration.
So I am really sorry to say we're closing in on our hour, and I just want to acknowledge one or two other comments in the chat. We don't really have time to sort of respond to them, but I think they're really sort of critical, and I want to acknowledge them. And they're really around sort of the issue. There's 2 or 3 comments related to this issue of, addressing the longstanding issues that impact the quality of life in our communities, and the tragic impacts that issues of unemployment, housing instability, and food insecurity have had on our populations. And, you know, expecting that these communities to put their energy behind, you know, vaccination efforts when we're, you know, they're still struggling with these issues. And I know that each one of you is thinking about how we should be simultaneously addressing those issues. And I just want to acknowledge that it's really critical and important that we all work together to continue to think about how to do that better and more effectively than we've been able to do before. I am really humbled by the level of engagement of our participants this evening. The conversation in the chat is really quite profound and important, and I'm really sorry I didn't get to everything that's in there. I'm going to work really hard with my team to try to synthesize some of this and make sure we get it out. We will be sending all of the participants a link to this recording, and we'll do our best to also summarize some of the takeaways and make sure we get you access to some of the resources that were shared. We're very, very interested in hearing your ideas about other conversations in community forums like this. We would love to host future sessions where we're talking about things that matter. There's a lot of activity that every one of us is sort of doing in this realm, but we need to be working together to ensure that we're not duplicating efforts and that we're complementing one another and that we're leveraging the voices of our community along the way. So with that, I want to say a sincere thank you to our 4 panelists. Each of you bring a level of sort of passion, commitment, and expertise that is quite exemplary, and I really appreciate your time and energy. And to every one of the other participants who are here this evening, I thank you for your participation, your comments, and your questions, and I wish you all good health and safety and a wonderful, happy Thanksgiving holiday.